Oh, that's a trick question.
They banned it.
You
In
used to
UAE.
have it here.
So they used to have it in UAE.
Go for your doctor and confirm with the doctor that you choose to do your treatment, please.
What is the worst trend have you seen recently?
Worst trend? Oh, that's a trick question.
Because your skin is already compromised and people start putting this yellow type of retinol and then they come to us with allergic reaction, with burns, with pigmentations.
Yes. You want results? This is the price. You want to pay for cheap products? Please, the others on the house first.
Finally, we're here, Dr. Sandro. Finally,
we're here.
Finally,
Man.
we've been planning to do this for so long.
We've
been planning to do it at
yes.
our houses. But finally, we're here in Élysée Hospital.
And luckily, we end up together in the same place.
Which better hospital to be? And yes, we're doing this.
I'm very happy to be here with you, man. And
Thank you.
I'm very happy.
And for people they don't know, but we're already friends before you start working here.
Exactly.
And I'm so happy to have you over here. Now, going back to the topics. TikToks,
yes.
Instagram, bloggers, social media in general. We see a lot of trends. And people are starting to diagnose themselves, as we mentioned.
Yes.
Does it have advantage or not? I think if utilized correctly, you can have good information from these social media applications or platforms. But it does not replace the consultation with a doctor.
Never.
Every information has to be verified. We see a lot of trends, but at the same time, the doctor should not follow trends. The doctor should follow scientific research.
Exactly.
You know? And it should
exactly. That's interesting you're talking about because, you know, we cannot ignore the power of social medias nowadays. It is not like before that, oh no, you just have to follow what's the published material, scientific published material, and that's the only source of truth.
Definitely.
Because today, the connection between people in social media, we can connect everyone to everyone, so everyone can share their experience. So social media itself, it's already a scientific study by itself. And there's a lot of people that doesn't have any background in scientific studies. They are not professionals. They're just talking. And there are a lot of good people, real good professionals, and they're also in social media giving good information. It's up to you to find out who's the best source for finding your information. Okay, don't stick with one only. Go find other sources and check it. And in the end, go for your doctor and confirm with the doctor that you choose to do your treatment, please.
And actually, this is the point of the podcast that we're doing, is to be professional, to listen to two professional doctors talking about these things and to give exact, like, evidence-based information to the patient.
What really works, what doesn't work, what you can go for, and what not.
What is the worst trend have you seen recently?
Worst trend? Oh, that's a trick question.
I know we don't spend a lot of time on TikTok, but from the time that you spend, what is the worst trend you think?
The worst trend I've been seeing now, although I'm very enthusiastic of it, I love peptides.
Peptides, yeah.
But I've been seeing a lot of misinformation and people that has any backgrounds in medicine or science, and they're giving advice to people about peptides without any scientific knowledge about it. So this trend, like this, you have to be careful. You know, that can be harmful. But if you use it correctly, it's amazing.
For me, I've seen the word Korean used before every procedure. And when you follow and you listen to what they're saying after, you see it has no scientific base. I'll give you an example. You would see something called the Korean Botox. So I thought before, like, it's a type of botulinum toxin that is manufactured in Korea.
Yes.
And no, they bring the Botox and they inject it all over the face, haphazardly, without specifying which muscles should be relaxed, which muscles should be ignored.
That's one thing that you mentioned that's very important, that I agree totally, is people giving names to their treatments.
Yeah.
They call it K-Botox, beauty lips,
beauty,
Hollywood, Hollywood glow, something like that. But it's also always the same procedures that we do,
That we do,
and
yeah.
just change the name, using the same products just to attract you. So don't go for these beautiful names. Check what is the procedure before, what's being used, the concentration, because sometimes you're paying more for something that is less than what's being used routinely.
To be honest, living in UAE, I understand they use some names for marketing reasons.
Yes.
It doesn't bother me as much as when you see people doing like the misinformation. Like you hear Korean glassy face, and then when you see
What is that?
like they do the dermapen, and after they recommend them to use a high concentration of retinol, which is contraindicated after you do that procedure because your skin is already compromised.
Yes.
And people start putting this yellow type of retinol, and then they come to us with allergic reaction, with burns, with pigmentations.
Yes.
And how did they do it? Because they followed it on
The trends.
Instagram.
Exactly.
They followed it on TikTok.
What worries me is not the patient following the trends in their homes, which is also worrisome. What worries me the most is when doctors
Do that.
start following the trends.
Yes.
Oh my
That
God.
is- that is,
The patient, okay, the patient, he doesn't know.
Yeah.
He's being naive, but the doctor is the scientist.
responsible
He
for that,
should know what he's doing. Okay? He cannot
Definitely.
follow trends.
Definitely. Going back to Botox, from Korean Botox to Botox, there is it's not a trend, but there are people right now who are doing what we call preventive Botox or prophylactic Botox.
That's has always been like this. Yeah.
What do you think of that?
No, I'm a big fan of Botox. I think the purpose of Botox is mainly to prevent the lines from coming. So I think Botox is mainly preventive than used as a treatment.
Definitely.
Okay. And I've been seeing some other doctors, older ones, they started to fight the Botox without evidence that's saying that Botox can make you age faster, which we have Botox for 30 years or more. And so far the evidence points towards the opposite. So I think that's the kind of misleading and counterindications that we see in social medias that we have to be aware of. This guy sometimes is going to trend just because he's saying something that's not true, but people want fight something that they should not.
They should not.
Yeah.
I totally agree. No, with that I totally agree. The
And
debate,
what do you think? What do you think
I'll
about
tell you.
the Botox as a preventive?
the question that I always get asked is about the age. When do you start?
Oh.
And when not to start.
Okay.
And I would say it's totally specific.
Totally
For
specific.
per patient, you know.
Yes.
Our skins are different. The tones,
Yes.
the thickness,
Yes.
the muscle strength.
Yes.
And I wouldn't start too much early on, to be honest.
I'll give you another question. I think
Yeah.
which is the youngest patient who ever done Botox?
I don't remember the exact age, but I will tell you between 19 to 21.
Okay.
And why. The reason
Yes.
is why.
The reason, this always should be
There is
the answer.
Yes.
Is the why.
Is the why.
Yeah.
So the why is because this patient, she was obese and she lost a lot of weight. And during the process of losing weight, she was working out and she had developed also muscle strength. And that combination of loose skin and strong muscle with weightlifting caused her to have very visible lines at a very young age.
Yes.
And she had zero contraindication.
Exactly.
So we
Why
started
not?
with her, giving her
Yes.
Botox, and she was very happy with the result. The only issue is she got addicted and she wanted to do it now every 2-3 months. And I tell her, no, wait, you still have, the effect is still working for you.
Yes, yes.
What people don't understand about Botox is we are not trying to give you poker face.
That was at the beginning, 30 years
Yeah.
ago. This doesn't exist anymore.
We're trying to keep your natural expression.
Yes.
You can raise your eyebrows. You can get angry at your kids. And at the same time,
and keep your expressions.
we hide the static lines. And for men, even, I sometimes intentionally keep dynamic lines.
Me too.
You know?
I think men with no lines, especially men after 35, that it's a sign of maturity for the man. If you raise up all the lines, it will look so fake. So men, he deserves to have a little bit of lines because I think it looks good.
Now, you have noticed people are using fillers less than before, right?
Yes. There's a couple of reasons for that. But,
What do you think is the issue? Is it distorting the face? Is there any new study against the filler?
Yes, so there are two things. There are one positive thing about it and one negative side of it. So the positive thing is that there are a lot of other products coming to the market, like biostimulators, bioregenerators that can be associated with fillers that also gives good results. That's why the demand for fillers decreased a bit, but they're shifting to other kinds of treatments that can be associated. And the negative one is the bad outcomes that we see on social media. The pillow faces that we see around, and people get scared because they think that all fillers, they will do the same. And it's like, blame the product, not blame who's doing it. Definitely. Okay? Yes, definitely. And that's something that I urged everyone to think about. Okay? It's not the product that does harm. It's who's injecting it. So indications matter in fillers.
Definitely.
Always. I always like to say, fillers, for me, it works for two things: loss of volume and contouring. And that's it. What do you think? Why do you think this is happening?
This is happening.
Yes.
Definitely, I agree with the point of biostimulators. It took a lot of the filler markets. I think people are tired from seeing the overfilled lips. People are tired from seeing the square jawline. People are tired from seeing copy-paste of
puffy eyes,
and all of these things. And what I developed in my practice right now, I have certain areas I inject with filler, and I can give very good results with these fillers. And for me, it's irreplaceable till now. I'll give you example, temple area. I love to put filler in the temple area, and it will not give an unnatural effect. For lips, still we're using, that's our best option. You cannot put a biostimulator for the lips right now, so this is our best option. Early on in my practice, I stopped putting fillers under eye. It's one of the areas I don't like the Tyndall effect. I don't like
that comes in the positive background because there are better things that we can inject under eyes nowadays.
Definitely. I decreased the amount of filler that we use on the jawline. I still use it because it's good contouring. But patient selection is the key.
It's indications. Yes.
It's
an indication for the patient, indication of the proper product, because the same filler that you inject in the temple is not the same filler that you can inject in the lips.
Definitely.
And about what we see, these overfilled lips, it's like sometimes it's what the patient wants. He wants that fake lips, which I don't agree, never, you know. So what I want people to understand is that we can make it look fake, or we can make it look natural. That's up to the patient. But if it's up to us, we always choose naturality.
It's about placement. How you're placing it, at which level, the amount of filler that is used, and so I totally agree with that.
Yeah, and speak about trends.
Yeah,
what do you think about the salmon DNA?
I actually love it. I've been all the way to Korea. I caught the fish in my own hand. I reached to the source. I made sure I know what is salmon DNA and how to utilize it. I've been using it actually a lot before it became trendy, and I've seen the effects. Of course, there are different brands and different concentrations and different methods of using it.
Yes.
If utilized correctly, if you chose the right patients, you will have really good result. People think it's like a skin booster. It is not.
No.
When I'm trying to treat the patient, I say this is, for example, beautifying technique, and this is a treatment technique, and this is a skin rejuvenation technique. So for me, salmon DNA is a treatment. I'm treating the layers.
You would classify like salmon DNA like a regenerator.
Regenerative,
product.
definitely under regenerative.
So it will
medicine.
work better on inflamed skin, in inflammation, reduce inflammations, rosacea.
100%.
Yes.
You can choose these cases. I will work on acne scars. I will work on pigmentation. I'll treat under eye with it. I'll treat, and you know, when we were learning about salmon DNA, they showed us amazing cases of using salmon DNA for treatment of burn, scars, using bigger amount of salmon DNA than the ones we use over here.
More concentrated.
More concentrated and more volume, but they give amazing result for the skin. And yes, I think this is, if the doctor wants to create the trend.
When we think about a regenerative
medicine
and regenerative treatment, which is salmon DNA, I do that. What do you think? I like the combination of salmon DNA with exosomes. I think exosomes also, they are good for regeneration. So this combination, I think, is very powerful.
Definitely.
What do you think?
I definitely agree with you, because they work on different skin layers. So you can definitely combine these two. The trick is choosing the right product and choosing a good doctor who's trained to use these two products. Because we hear exosomes a lot.
Oh, yeah.
And you can see...
when I say exosomes, I'm saying the one that really works.
Yes.
I'm not talking the plant-based.
And we've tried a lot of them that has as much effect as saline, you know? And,
yes, exactly.
And there are the real exosomes. And even PRP, and I utilize PRP a lot in my treatments. Even PRP, you can have a very low concentration of PRP, and you can have the best one that will give you very high concentration. And the patient doesn't know. He say, no, but doctor, but I went to this clinic and they charged me only this much for PRP. And I have to now explain to him that this is totally different.
You kind of wasted money
and that is not effective. And I tell him, if they use this exact PRP, they will charge you 5 or 10 times more.
That's one thing that, guys, be aware of low prices in clinics. When they offer products for low price, don't go for low prices. Go for good results and quality products. Always check this.
I have a nice question for you, and this is about communication skills. It's not related to when a patient tells you, I went to another clinic for the same procedure and they offered, let's say, 50% of the price. How would you answer them? Because you can have more than one answer for the same question, right?
Yes, there's many answers for that question, you know. I don't think I have the exactly, but first of all, I would try to understand why they're charging that less. Check which product they're giving to the patient. Check the concentration of the product that they're doing for the patient, and then I'm going to reason with the patients. Listen, you're not paying for the product. You're just paying less for water. Okay. If you want to pay for results, this is the price.
This is the price.
You want results? This is the price. You want to pay for cheap products? You can go to that clinic.
I found a very good answer. I mean, your answer is good, but it takes a long time.
Yeah, true.
Because and then sometimes you might fall into the trap of you have to criticize another clinic or a doctor, and as doctors we don't always like to do that.
No.
But educating the patient is good. So now, what I found that really works and is actually very true also, they say, listen, for that service, for what we're offering, for our quality, this is a very fair price. You should ask that clinic, why are they so cheap? What's wrong with their, So I flip the question. I say, for me, this is a very fair price for this service. So how they're reducing the price for you, you need to investigate them rather than investigate us.
And you have to decide what's more important to you, if it's the money or the results.
And then definitely the patient will actually do that. They will actually say, you know what? He's using Sculptra, I'm using Sculptra. Why? Why
What's the
is
difference?
this?
Yeah.
And then they will ask, is it Sculptra?
Yes.
Can you send me the photo? Is it the real product or is it a knockoff product? And they will come back telling you,
Okay,
doctor.
and I think it's nice we touched that subject because I think it's also important for us to alert the patients what happens sometimes.
Yeah.
There's something called black market.
Definitely.
Okay, there's something
Definitely.
called black
And
market.
people don't know.
Yes. Sometimes they have the same bottle, the same vial, for example, Sculptra. There's the same bottle, same vial of Sculptra as the original one. Okay, but one is faked.
Yeah.
It's fake. It's produced in shady places. There are people doing falsifications of Botox, of fillers, of Sculptra.
biostimulators.
Okay, so they're bought in black market. They're not bought from the distributor itself. So when the product comes directly from the who manage the factory and the distributor register from the factory, you know they're purchasing the original one. When there are a lot of chains after the distribution and you're not buying directly from the original source, then anything can happen. You can't know if that's the original product or no, and that's why you get cheap prices in most of the
Definitely.
times. Yes.
I will add on to that, actually. There's another level to this. So sometimes you're actually not buying a knockoff product. So sometimes it is the same Sculptra produced in another country and transported here without registration, without DOH registration. And now what happens is also it will be cheaper.
Without
because it's
proper storage.
Exactly.
Yes.
So not the proper storage, not the proper investigation of how it was, how did it reach to UAE? Was it under the right temperature? Was it under the right standards?
This happens a lot with Botox.
Yes.
So when they're buying from sources of Botox, for
Yes.
example, Botox has to be refrigerated.
Exactly.
All
the
since
way.
it's produced,
Yeah.
it has to be refrigerated. If
Definitely.
it got a little bit after 20 degrees, it's over.
It's gone.
So imagine the process of this storage and transportation between all of this. You lost the product.
So
No?
that's what I'm trying to say. Even if it's from the same product and it's not a knockoff, but if it comes in without registration, that means the proper due diligence has not happened of how it was stored, how it's delivered, is it registered. The products we're using here, any patient can scan the barcode and can track them.
That's true.
All the way to the manufacturer.
Yes.
From all the way from the if it's in Italy or in France
Yes.
or US,
all the
way
chain of production
till it came
until
to
the clinic.
UAE, where it was stored,
Yes.
how it reached to Elysee Hospital, and even after injection, we added information that they can track that this was used, it was this batch, this expiry
You
date,
can check
and,
everything.
and
Yes.
you can check it all,
Yes.
and it will all be documented. And then even in case of any side effect that happen, when you have such a registered product, then you will have the support of the doctor and the support of the company.
The company, yes.
That will
and the
take care-
pharmaceutical
Yes.
company. Okay.
So they will either
Yes.
replace give you another procedure. They will make sure that the complication is gone because it's their responsibility as
Exactly.
well as the doctor. When
Exactly.
you use any knockoff product, that's it. There's no warranty on that.
Guarantees with you. Yeah. You chose that, so
Yeah.
yes.
So we spoke a lot about the face. Do you want to
Yeah.
touch on anything about the body?
Oh yes, body is my favorite area to treat. You know, especially cellulite and body
Cellulite,
fillers.
yes, yes,
that's
yes.
amazing. So do you do body fillers? What do you do? Do you do
I-
cellulite treatments? What are your favorite?
I love. Actually, I think it's still a challenge, to be honest.
Yes.
In
It's
the-
not an easy procedure,
in
especially
the
cellulite.
aesthetic industry, it's
Yeah.
still a challenge. If you see a lot of Arab patients here, we do have a lot of cellulite.
Yeah.
And due to different reasons, maybe genetics a little bit, maybe environmental, maybe
Yes.
lifestyle.
Lifestyle, yes.
The women, they have a lot of pregnancies and
Yes,
childbirth,
true,
so
true,
these are
true,
all
true.
contributing factors.
Yes.
I use a combination actually of few materials, having the body filler, having subcision techniques, having biostimulators, more than one, injecting on different levels, because as you know, the cellulite could be deep, superficial, and could be
Yes.
different types of cellulite, different stages of cellulite. So when I do this combination plus energy-based devices, you will have as much as you can say, I mean, a doctor cannot say guaranteed result, but as much as close to guarantee as possible.
We won't say guaranteed results. What I want to say is that when you treat a cellulite, the results that you get from that treatment is permanent.
Definitely.
The treatment of cellulite is permanent. I'm not saying that you're not going to develop more cellulite over the years if you don't change your life habits, but that treatment that you did and that percentage of improvement that you get, for sure, that's permanent.
Definitely.
When you do the proper treatment with cellulite.
Since we are at the body, I wanted to ask you, and I know you have some special techniques, some special interest in treating the body, whether it's with fillers or with other things. So what would you say your niche when it comes to the body treatment?
Yeah, my niche in body fillers, I like a lot about butt volumization, gluteal harmonization. That includes not only give shape, contouring, volume, but also treat the texture. Talking about the cellulites, the treatment for cellulites sometimes can be associated with the treatment for volumization. And the only thing that's different that is the type of products that we have here in UAE and the product we have in Brazil. Yeah. Okay, because here in UAE we do body volumization with body fillers, which is hyaluronic acid, which is a different kind of hyaluronic acid that's specific for the body. It has a higher weight molecule, bigger size of molecule. It's not the same that we use for the face, that we have to register this, because I've seen people injecting body fillers in the face.
Yes,
it was like, what?
I've seen that.
Okay, so it's very safe procedure with hyaluronic acid. We can get amazing results, but it's not a permanent one. Okay, it has to be injected above the muscle in the subcutaneous layer. Okay, and we can do as many sessions as needed to get the final result. But the one in Brazil, it's a different kind of product.
I know you like that one.
Oh, I love it. I love it. It's called PMMA. It's called polymethyl-methacrylate. Some people, some doctors, they hate it because they don't know how it works. They don't know the product itself. But the results that you get from this product, and it's permanent, it has to be injected inside the muscle. Yeah. So that's why it's a little bit more complicated to be injected than hyaluronic acid. It has to be, the patient has to be analyzed, has to do an ultrasound before and after the procedure. But the result the patient gets seems like she's been working out her butt since she was born, and the texture becomes amazing. It treats the cellulite, it treats the texture, it gives volume. It's amazing result. That's the real Brazilian butt lift. And I spoke with the company there that produce. There are only 2 companies in Brazil that produce these products that are amazing companies, and we try to register here in UAE. I hope we get approved and we get to start doing this, because this will change the game in body fillers.
I'll give you a bit of history. I don't know if you know it in UAE. Just when I start into aesthetics medicine, or even a little bit before that, they banned it.
In UAE. Used to have it here.
So they used to have it in UAE.
Okay.
And they banned it. And it was injected.
I think again, blame the product, not the injector.
I will tell you exactly what was happening. When it was introduced to the market, it was introduced to mostly plastic surgeons. Okay. And it was not done as you just explained it.
No.
It was done. It was used as sub-Q. And it was used superficial.
Yes.
And it had...
It can give complications.
I actually did a lot of MRIs with people who injected it before. And there were... and it was never in the muscle. It was never even close to the muscle.
That's when the complications come.
It was superficial, and it had pockets. And then people had to redo surgeries, and some had abscesses, and we had to treat the abscess. So I think that's why it gained.
Because it's a permanent filler, it cannot be removed. So when you have a complication, you have to go under surgery to remove it.
Definitely.
But if you inject in the proper layer with the proper technique that's inside the muscle, there is never a complication. It's perfect. But if you place it above the muscle in the subcutaneous layer, you're going to have nodules, and those cannot be fixed. They have to only be treated with surgery. And so that's why the product, it's amazing if it's well executed. If it's not well executed,
It's a very good example, and it reminds me of something that I do, which is the threads.
the threads.
And the threads had a very bad reputation because when it was introduced, the doctors were not well trained. They did not understand the product itself. They did not understand at which layer you put the thread. And it was painful for the patient. And it
The
was
recovery time was, yes.
Yes, and when I was trained for the threads, I had the luxury to be trained with the best doctors that are using threads, whether in Canada or in UAE. And as long as you choose the right patient, I had zero complications with threads. I loved the results. And the threads sometimes will give you results that no other product will give you.
Yes.
So, doctor, I know you're an athlete. I know you love sport as much as I do,
Yeah,
maybe even more. I know we both sometimes train together.
Yes.
And we are interested in something that I don't think a lot of other doctors have a lot of knowledge about or that interest because they think wellness or aesthetics is only for women.
Okay.
But now we're talking about men wellness
Okay.
in optimizing performance.
Okay.
Whether it's about the looks or about the body or about the movement. So what's your idea about this and what do you like? How do you want to expand on this?
Okay, so that's an amazing question, and I would like to clarify something that's gonna get in your heads, and you understand it easy. Before we only say aesthetics, okay? What is aesthetics? Everything that makes you look better, not just by the looks. So I think aesthetics is not only what people see in you, but also how do you feel about yourself. This is part of aesthetics. So there is a part of medicine now that's a new area on medicine that's called regenerative medicine and can be completely associated with aesthetics. Okay, so now we are merging aesthetics with regenerative medicine because everything in regenerative medicine will work for your aesthetics, will make you look better, will make you feel better, will make your body works better. So that's what we're always looking in aesthetics, not treating only the outer layer, but everything's in combination. So the new things coming for the market, like peptides, stem cells, these are all part of aesthetics as well. So we can use those as tools to improve our treatment in aesthetics, right? What do you think?
You remind me of a research that I did with my father. We were doing about like a lecture about plastic surgery and about beauty, and we wanted to define beauty, and it was very hard.
It's very
because it had a different definition.
Yes.
But after a long research, we found out that the most consistent definition is beauty is health, and I'll give you examples about this.
Good definition.
Okay, I'll start with men. For example, all women consider a man who has like clean skin, good hairline, broad shoulders, low fat, consider him as an attractive man, you know?
Yes.
Even the square jawline. Now, if you break down all of these, you will see these are all signs of health. They are not signs of beauty. They're signs of health. Having good hairline is a healthy hair. Having good skin, that means he took care or he has good genetics for the skin.
Amazing.
Square jawline, that means he had good testosterone production.
So anyways, I think we have a lot of subject to talk
Yes,
about. We still
totally.
have a lot of things to talk about.
Totally.
And for me, it was amazing to have this first podcast with my best friend here.
Definitely.
It's
just like us hanging out. Well, now this is what we speak when
About the
we're
booze.
hanging out, but now people are seeing it. So I really enjoyed it. Thank you very much, and to be continued, huh? To be continued.